Thanks for joining us for our latest Ask the Mito Doc webcast. Tonight's topic is back to school and work, and we've got a terrific panel for you tonight. Doctors Mary K. Koenig and Ebony Beaudoin Health McGovern Medical School in Houston, Texas. And if you've watched the news today, you know that there is a hurricane hitting that area. So the doctors have graciously taken some of their time tonight. We are always so happy to be able to bring you important programming like Ask the Mito Doc webcasts. And they're made possible through the generosity of these sponsors. So we ask that you join us in thanking them for their support. And now I'm going to turn things over to our panel with Dr. Koenig and Dr. Beaudoin. Dr. Beaudoin will be making a presentation for us tonight.
Good evening, everyone. I'm here with Dr. Koenig, and we're just going to briefly go through some of our presentation, and then we want to have an opportunity to answer any questions that you guys may have. So I'll go ahead and share my screen, and we'll get started. Okay, so we titled our presentation, Mitochondrial Disorder in These Bugs. Which one is it? Okay. So we're going to just talk about some of the common bacteria and viruses that we see during cold and flu season. And I'm going to talk to you as a general pediatrician about how we manage some of the symptoms that we often see associated with these illnesses. And then we'll talk about what the AAP, which is our governing body, the American Academy of Pediatrics, recommends. And then we'll talk a little bit about COVID-19 and what our current guidelines are for vaccination and those things. So typically we will divide the organisms that we see into viruses, which are much more common, and the bacteria that we see. So anytime we get a pediatric patient in with cough, congestion, runny nose, or whatever, we think about these illnesses commonly. So of course, flu, which we're just starting to see flu, we didn't see a lot last year because everybody had on masks and people got vaccinated, but we're starting to see both types of flu this year and some rarer types of the type A flu. So we are encouraging everyone to get that vaccine, and it's available pretty much worldwide now. Rhinovirus, which is the most common cause of the common cold. We've been seeing that throughout the pandemic, and we've seen a peak this summer. And then there are some of the more rare viruses, adenovirus, RSV, which we'll talk about in a few, the parainfluenza virus, which you guys would commonly call croup. We have seen a little bit of that. And then something I see a lot in my Mito kids is human metapneumovirus. So these are all viruses that we're able to test for. And the difference between a virus and a bacteria typically among us is that most viruses we're going to treat with supportive care. We're going to talk to you about making sure your child is hydrated, making sure your child has good urine output, making sure we control the fever. Versus the bacterial infections, which we listed here, these are going to require antibiotic treatment. So anytime you go see your pediatrician and they will have a long drawn out discussion with you, anytime you're getting put on antibiotics, they pretty much suspect that there's a bacterial infection going on. These are the most common bacterial infections we see, those three in kids that will cause illness. Things like sinusitis and ear infections, you know, that nasal congestion that's gone on for more than 2 to 3 weeks. Then we start to suspect that even though your child may have started the illness off with the virus, that somehow a secondary bacterial infection creeped in. The other good thing about the bacterial infections is that if your child is fully vaccinated, we vaccinated against at least those first 2 organisms, and we've done so pretty effectively. So we will rarely see these unless your child has some problem with their immune system. So we're fighting the good fight as pediatricians and you as parents by getting vaccinated, but we want to do everything we can to protect your children. So symptoms that we see with the common cold, cough, runny nose, sneezing. It may just be sneezing associated with allergies, but typically that you're gonna know if your child has allergies. They're gonna be itchy, watery eyes, clear runny nose, and not really feeling bad. Anytime your kid is kind of laying around, not being themselves, not playing and eating, you out of house and home, you kind of suspect that there may be something else going on. With allergies, kids will typically have their normal activity level, and they may have some sneezing and stuff, but not the other things we see with a cold, like headache, nasal congestion, malaise. I don't want to eat, mommy, I don't want to do this, I don't want to go outside. And then fever. Anytime we see fevers, we know it's not going to be allergic rhinitis. So what are we seeing now mostly? Of course, we're seeing COVID-19, right? The other thing though that we're seeing a lot of is RSV. Now, this is a virus that we typically see in little ones, so our newborns up until about 3 years. And we typically see it starting around now up until spring, April, around March or April. However, what we found out is that last year everybody took off their masks and then, had on their masks. And then around springtime, people made the decision to stop wearing masks for whatever reason. So we had this premature peak of RSV, and it's gone on, and it's reached a peak in the summer months in July and August, but we still haven't pretty much pediatric hospitals all over the country, which are full of children who have RSV. Now, like I said, typically we see it as up until age 3, but because a lot of the 4 and 5-year-olds were masked up last year or in the house and not in school, they may not have gotten this virus. So we're seeing older children now getting this. And the symptoms can range from just your child having a mild cold with a little cough, a little runny nose, maybe some decreased appetite, to full pneumonia or bronchiolitis where they're in an ICU setting with a ventilator. What we also know is that we typically see worse infections in children who may be immunocompromised, those babies who have congenital heart disease, our mitochondrial patients, and our premature babies. So definitely it's a virus that we do supportive care for. As you see, this baby is receiving a breathing treatment because some babies do get the bronchiolitis with wheezing, but the primary treatment is typically supportive care. Now, what I will say is that we do have, for premature babies who are less than 2 years old, we do have a shot to prevent it because we know the outcomes can be pretty bad for especially our former premature babies who get this. But, there's not a lot we have in terms of management that improves outcome in these children. So definitely we want to be careful to try to prevent it, but know that it's out in the community and it's out at a pretty high rate right now. Okay, so what do we as pediatricians worry about? The first thing I do when I see any kid with a cold is look at their breathing. I lift their shirt. I want to see, are you breathing fast? Are you breathing hard? And that is one thing I always encourage the parents to keep an eye on if I send any kid home with a cold. You watch the breathing, if your child is sucking in up above the clavicles, if you can see the ribs or the belly popping in and out, that's definitely an emergency. Any kind of difficulty breathing, you want to get your child to the emergency room immediately. Decreased urine output. For us as doctors, it tells us so much about a kid. Kids are, not miniature adults. They don't have the fluid reserve that we have as big people. So if you see that they're not drinking, and they're using a lot of fluids to cool their body because they're having fever, and you see that urine output go out, that to you as a parent lets us know you need to get them in to be seen or do whatever to keep them hydrated. One thing I will always tell parents is I don't care if they eat for the next 3 or 4 days, as long as they're staying hydrated, because that keeps them from getting very ill. Anytime you see decreased activity, high fevers up above 102 definitely are cause for concern for us, because then we know that there's more likely some kind of underlying bacteria infection going on. Any kind of uncontrolled vomiting or diarrhea, because remember, that's fluid loss and we don't want to lose a lot of fluids. Anytime there's headache, especially headache and vomiting, we always worry about meningitis, which we know can be deadly. And I will always tell any parent, you know your child best. I'm with your child 15 to 20 minutes to do a visit. You're with your child 24 hours a day unless they're in school. So if you feel as a parent that things are not right, you go and you advocate for your child to get the resources necessary to get that child better. Oh, okay. So the other thing, of course, we're seeing RSV, we've seen a little flu, and of course, we're seeing this pandemic that just won't quit. I was looking at the data today, 240,000 new cases for pediatric patients in the past week, and that's just the children, you guys. We're up 240% from July, and we're gonna continue to climb. Kids are back at school. Kids do not have to wear masks in most states. So the rates will continue to climb. Our hospitals are inundated here in Texas. Our ICUs are full. Our pediatric floors are full of kids who have mild to severe COVID disease, okay? And although like adults, most people will have mild symptoms. Kids will have it and you may not even know. They may be completely asymptomatic. We are seeing much higher hospitalization rates and much higher ICU rates. So, and here in Texas, we've had 2 pediatric deaths, 1 here at our hospital. So it's hit very close to home. And while we're doing everything we can, you know, the doctors are burned out. The nurses are burned out. We are fighting the good fight, but it's been a tedious journey. And it looks like in terms of pediatrics, we're getting close to where we want to be. So COVID, like any other virus, because it is a virus, the symptoms may be minimal. The things, of course, that we know that are typically different that lets us pretty much know that you have COVID is if you lose your taste or smell. This is not something we're seeing a lot of in children, though. What we are seeing is just typical cold symptoms that may lead to increased work of breathing. We may see some body aches or fatigue in kids. Sore throat is a big one we're seeing in kids. So while we're not seeing a lot of things like strep throat, we are seeing kids presenting with sore throat and cough, and they end up having COVID. And then in kids, we're also seeing a lot of nausea, vomiting, diarrhea. So if your kid has any of these symptoms, sore throat, vomiting, diarrhea, definitely loss of taste or smell, they really need to have a COVID test. You need to be isolated and they need to be isolated until those results are back, okay? So what can you do? Definitely we wanna limit exposure when possible. We know it's a challenge. We all miss our families, but we're at a point now where we are able to visit safely. We're able to do outdoor visiting. We're able to get our vaccines. We definitely want to wash our hands. That is the biggest way to prevent most infections. Wash your hands. I tell parents, for parents especially who have school-age children, go ahead and have your kids change their clothes, blow their nose out when they get home from school. So that way they're eliminating most of the germs that they would encounter during a typical school day. You want to avoid touching your hands and face, which I know I've done it since we've started lecturing, and it's very hard not to. But if you have germs on your hands, you touch them on, you're creating a pathway straight to your lungs where you can allow bacteria and viruses to enter in. And then mask up. This is honestly my baby on her first day of pre-K4, and she's masked up, and she understands because I've sat with her and I've educated her on the importance of masking up and the safety, and we've been allowed to remain COVID-free. So, and so what are the guidelines on masking? Definitely indoors, we want you to wear your mask until we're able to get a better grasp on this pandemic. Anytime you're in the grocery store or in your local Target, my favorite, or Walmart, we want you to wear your mask. Definitely want teachers, staff, students, kids. If your child is able, we want your child to be masked. I was actually talking with Dr. Koenig the other day, and we get a lot of requests for parents to have their kids not masked. There are very, very few times when we don't want a child with mitochondrial disorder to be unmasked in a school setting. Anybody who's unmasked, unvaccinated, we definitely want you to be masked at all times, especially in states like Texas, where we know our COVID rates are totally out of control. Now, definitely indoor sports activities. But if you're outdoors, if you're going to an NFL game where you know there are going to be 40 to 50,000 fans, please wear your mask. Be that person that helps protect and stop the spread of this horrific virus. And then anytime you're traveling, we know the airlines require it, but we're talking about riding your local trains. We're talking about any form of public transportation, whether that be the city bus or whatever. And then vaccinate. What we found was that there was such a significant decline in children getting routine vaccinations. So we want to encourage you to have your kids caught up on vaccines. We want you to encourage to get your child the flu vaccine. As you can see, we talked about pneumococcal in the beginning, the pneumonia vaccine. And we get, those doses really early in life. You can finish them by 15 months. But they protect against 80 to 90% of pneumonia. So definitely, we want to get that done. And then your annual flu shot, if you haven't done so, and I haven't, want to get that done. I'll be doing it soon. And then know what's available in terms of your COVID-19 vaccine. We're dealing with a younger population, but Pfizer is approved for ages 12 and above, and we expect it to be approved for ages 5 and above by Halloween, and we're all looking forward to it. But Moderna is approved for 18 years old and up, and Johnson & Johnson is still out. And that's a typo. It's approved for ages 18 and up also. So what we know about kids with Mito and common colds, we know that these kids are at increased risk of having compromised immune systems. And I always tell parents that mitochondria is your energy. So of course, they're going to decompensate quicker and usually have a harder course and a harder recovery than a typical child. So what we want to do is keep our children at their baseline as long as we're able to. And we know that every virus has the potential to set you back from your pre-illness baseline. So if we're able to, we want to prevent some of these illnesses like COVID and RSV from even happening. So today's statistics, I hate that word, 41 million cases of COVID in the United States. And this was updated today from the CDC. 279 new deaths today from the CDC. Total deaths, we're approaching 700,000 deaths from a preventable illness, from a vaccine preventable illness, just like polio and measles and all the other things. So while we have a long road ahead, we feel like opportunities like this help us to educate people and help us all to make good decisions that will hopefully improve these numbers. And hopefully before the end of this year, we will start to see our death rates and our numbers start to trend down. There's not a lot we can do in terms of school and the rules and the laws in our state, except for vote, of course, and discuss it with our elected officials. But you masking your child, following protocols, you as a parent being vaccinated helps us so much in the fight. So the journey ahead is long, but we will get through it, and we'll get through it together. And that is the end. Any questions that you may have, feel free to put them in the chat.
We do have questions, and
okay.
I will start them off. So a lot of questions were submitted before we did the webcast, and we get this question quite frequently. So I want to ask and get your take on it, both doctors. And the question is the vaccine safe for those with mitochondrial disease? We get that question quite a bit.
Yeah, so I'll take that if that's okay. So
Sure.
the vaccine is safe for those with mitochondrial disease. We've been recommending it to all of our patients with very, very isolated exceptions. So we have looked at vaccination in mitochondrial patients over the years very closely. And in general, it is considered much safer for mitochondrial patients to receive vaccinations than not. And I cannot say enough times that there are the isolated exceptions. So if you are one of those, please talk with your doctor, your immunologist about this. And I do follow patients where there are exceptions. But in general, a patient with a mitochondrial disorder is at a higher risk for having a severe infection than the general population. And therefore, they are more likely to need that protection that the vaccine provides. And so when you look at a risk-benefit ratio, their risk of receiving any vaccine is much lower than their risk of having the infection itself. So the same is true for the COVID vaccine. And we strongly recommend that any patient with a mitochondrial disease be vaccinated unless they are one of those few exceptions.
So a lot of people are returning to the workplace. A lot of children are back in school or will be returning to school. What do you think the biggest challenge is for an affected individual that has to send their child back to school or has to go back into the workplace?
I think the biggest challenge is children will typically comply to what what is presented to them, I will say. I think and I live in Texas, so things are a little bit different. I think we all need to be, I would say, have a consensus about how we're going to move forward as a nation. And I feel like when you have one state doing one thing, another state doing another thing, the fact of the matter is people are traveling like pre-COVID rates. So if if I go see my sister and her kids and I've been exposed, and even though they may wear masks and everything, I still bring the potential to her house. So I think we as a nation have to get on one accord about how we're going to move forward and manage this. And I think the standard needs to be the same for everyone. And if we can keep that standard the same and get the rates down, especially with the way we are vaccinating now, I think we will get there. And we will get there. It's just a matter of how and when.
And I think I heard you say that some children will be able to be vaccinated around Halloween, I believe you said. So when that becomes available, parents are asking what they should consider for their child before, and I'm speaking specifically about children under the age of 12, before they get that vaccine. What would you recommend?
So I definitely recommend, and any patient of mine who is a patient of Dr. Koenig's, I'm going to speak with her before I recommend a vaccine. I do have children who have rare responses to vaccines that I manage. If they have an immunologist, I'm going to also speak with them before we make this decision. So I definitely encourage open dialogue, and your provider should be available to answer any questions you have. But I will, co-sign what Dr. Koenig said. This vaccine has been proven very safe in most patients. Now, every child is different, and I will tell any parent, your child is no other child that I take care of. So definitely discuss it with your providers before making it. And then some parents just, are not comfortable until they've seen the vaccine be given in large numbers of kids. And, you know, I think that that's okay, but you have to remember until then, you need to do everything you can to protect your child. And that includes masking and social distancing.
You know,
Yeah.
we had I'm sorry, go ahead, Dr. Koenig.
That's right. I'd like to make a comment on that too. So, you know, I get a lot of questions from adults right now about, you know, the vaccine and do we recommend it? And, you know, well, it's only been around for a year, or a year and a half. And so, you know, is it safe? And the one thing that I can say with certainty is that it is not safe to get COVID. I am currently covering the hospital. I see over and over and over again people without risk factors in the hospital dying from this disease or having major complications from it. And this current variant that's going around is affecting children way more than the previous variant did, and is much more virulent. And one thing I know is that it's not safe to not get the vaccine. So do I know if it's 100% safe to get the vaccine? I know it's not safe to not get it. And I know that with 100% certainty. So I strongly recommend that unless there is some major contraindication or reason why you can't, that you get it, because I know what happens to people who don't. And certainly that doesn't happen to everybody who doesn't get it. But when you look at, again, the risk of getting the vaccine versus the risk of not getting the vaccine, and you have to weigh those risks against each other, the risk of not getting the vaccine starts becoming much, much, much higher than any risk associated with getting it. And I feel that way about the children as well. You know, most of my patients know that I have a 9-year-old, and he will be the first person in line to get vaccinated.
Behind my children.
You know, that's very sobering, because we don't see what you see, and you see it. You both see it daily. I have a question from a teacher, and it's kind of an interesting question. Elementary school teacher who is also a parent of a son with Lee syndrome. She works in a district where masks are not required, and sometimes the kids, as you know, kids do, run up to her for hugs, and she can't stop them because they're running at her. She wants to know your advice on what precautions she should take before she picks her own son, who is affected, up from wherever he is, school or whatever. Should she change her clothes before she goes?
Definitely.
What do you think?
So in addition to just routine asking for herself, I definitely would keep a change of clothes in my vehicle, and change if she's able to before she picks her child up. You know, when I do work the sick clinic, which is not often, I honestly am in the garage and I will change because I know I have 3 unvaccinated youth in my house that I have to go home, and I don't want them to, you know, have to deal with COVID. So I just take a change of clothes, and I have my husband like set my, you know, robe in the garage so I can go, and if she's able to, she should immediately shower before she interacts with her child. And that's the best way to protect him.
And she should wear a mask.
Definitely.
So do either of you know if anybody's tracking Mito patients that have contracted COVID and what the outcome was? Are there any statistics out there for that yet, or anything either of you know of?
That is a fantastic question. So I will tell you, when this pandemic started, I said to my staff, we need to track this in all of our patients. And the truth is that we've had so many patients that have gotten COVID at this point. We have not been able to keep up with the tracking. The person who I believe is tracking it is probably Peter McGuire at the NIH. But I don't know of anyone who has a specific role in tracking it, but I believe that Dr. McGuire might be.
I think you're right. I want to move on to booster shots because we're hearing a lot about that in the news now. Are they recommended? Should patients with Mito get the booster after they've had the vaccine?
So right now, people who are immunocompromised, it is recommended that they receive a booster shot. So if you are a mitochondrial patient and you are immunocompromised, then you should receive a booster shot. We believe that the CDC is going to be recommending shortly, any day now, that all people receive a booster shot at 8 months after their last vaccine. And so if you are already vaccinated and it's been 8 months since your last vaccine, then those people should receive a booster once the CDC issues that recommendation.
Okay, because we did have a question about 8 months from the last vaccine, and they were wondering if it should be sooner for a Mito patient.
If they are immunocompromised, then they should receive that third dose.
Yes.
Okay. If they had a reaction to the vaccine, the initial 2 shots, is there still a recommendation to get a booster?
So that one is something that I believe really should be addressed with each individual patient and their physician. I am getting this question a lot with my patients, and we are taking it on a case-by-case basis. I will tell you the things that we look at are, 1, how severe the reaction was, and 2, what their underlying condition is. So, for example, if I had a patient with Lee syndrome who developed an extremely high fever and became dehydrated, I might be hesitant to recommend that they receive an additional vaccine. But if I had a patient that was tired and lethargic for a few days and didn't develop a fever and they had a myopathy, I might be more inclined to recommend that they get a vaccine. So I really do believe that is a very individual decision that needs to be made on a case-by-case basis.
Okay. Dr. Beaudoin, I want to stay with you for 1 second on this booster, only because you mentioned this. You mentioned the annual flu shot, and that you didn't get yours yet.
Me either.
Well, we just got ours in stock last week.
That makes 3 of us.
Thursday.
So here's the question. What is the recommendation for the time between getting a flu shot and the COVID booster shot? What do you both think of that? Or I'm sure there's got to be some protocol.
So honestly, the CDC is encouraging you to get both shots, and they're saying you can do them together, which is different from last year's flu season. So those are the current recommendations that, if you're going into a CVS or Walgreens, if both are available, you go ahead and get both. And that is the latest recommendation. So we will, I don't know how many people are willing to do that, but.
Okay, I want to take some of the questions that have been submitted in the Q&A. And one of the questions is, working out at the gym, what's the recommendation on that? What's the precautions for that? Because a lot of gyms you don't have to be masked anymore.
Right. And so definitely if you're unvaccinated, we definitely recommend, which is very difficult, because the guidelines state that if you're outside and you're working out, you need to mask. But if you're unvaccinated and you're in a closed environment, you definitely need to be masked. And, if you work out, you know that they're not cleaning the gym equipment after each person. So you have an increased risk of obtaining a virus from that route.
Yeah, I think too, you can bring your own cleaning supplies and you can clean the equipment before you use it.
Great idea.
And you can also try to use the gym at times when there's not as many people around. And so the further away you are from people, the less likely you are to get something. And I would definitely, if you see anybody coughing, sneezing, that looks like they're sick, stay away from them. And so, there are ways that you can mitigate that risk a little bit, because exercise certainly is very, very beneficial, and you do want to continue to exercise.
Definitely.
But masking is the most effective way to protect yourself and others. So I think making sure you're bringing your own cleaning equipment and cleaning the equipment before you use it.
So we know that patients take cocktails, and one of the questions is there anything in addition to a cocktail, any other supplements that you would recommend that could help boost the immune system?
So there are some, case studies that say zinc and vitamin C may be beneficial in combating the virus. We don't really have any concrete data that says yes or no. I don't think that there would be harmful. And if you look at most pediatric vitamins, they do have a little bit of zinc, but a lot of them, even like the little Flintstone chewables, will have enough of the daily vitamin C for children.
Okay.
Just make sure you don't take mega doses of either of those.
And yeah, things like Airborne do have like 700% of your vitamin C. So you just want to be cautious with that.
What, with the Airborne?
Yeah.
I only ask because I take that every
So you can take that, just don't take mega doses of it. If you if you take too much vitamin C or zinc, it can actually be harmful. So
okay.
At what the RDA is, and don't go too far over that.
Okay. So what should a parent ask of their children's immunologist to see if there are any risks with, especially with a Lee syndrome kid, in getting the vaccine?
So I think it's definitely important to know what reaction your child's had to previous vaccinations. Remember, even the 5 and older, by the time you're 5, you should have at least received 20 doses of other vaccines. So if your child has had a reaction, especially a severe reaction to any other vaccination, I think it's definitely important to be vaccinated under the direction of your immunologist with your neurologist input. And I really feel like communication amongst your child's healthcare team is going to be so critical. I don't know how other places are doing it, but our Mito patients and our kids who are at higher risk, the providers are available when we do that first set of vaccines, and when we do the 3-week booster dose, if they're getting the Pfizer, which is all kids right now, so that we were actually hands-on, we had all the equipment available. And, that's something parents may be able to suggest to their providers and their healthcare team, so that if there is an emergency or reaction, you have somebody there. The other thing is most of these kids are going to be followed in a large medical system. So, know what resources are available when your child gets vaccinated, so that if there's an emergency situation, how does the team plan to respond? I've had to go down with a couple of my patients because they're like, well, what if something happens? Okay, I'm gonna be right here. If something happens, I'll be with you.
So one of the questions coming in is and either of you feel free to answer. What are your views on antibody testing and using that as a guide for getting a
for getting the booster? So I don't know if you know about that. So we know that people can have antibodies and still achieve greater protection from being vaccinated. So there have been studies that have been done in the adults that show that the people who are the most protected are people who had a natural COVID infection and then subsequently got 2 vaccine doses. They're more protected than people who just got a single vaccine, or much more protected, that just got the vaccine, and much more protected than people who got a natural infection. So just having the antibodies themselves doesn't necessarily provide full protection to you. And so I think that we don't really know yet what level of antibody would be considered protective. So I'd be hesitant to say just because you have antibodies, you're protected.
Especially against some of the newer variants. That's another thing we're unsure of, the Delta variant and now this Mu variant. So while the scientists are working hard, I think that there are a lot of questions that still need to be answered.
Dr. Beaudoin, you raise a good point. We keep hearing about these new variants, and I guess I hope for a day when we won't hear about a new variant, but how long will that be?
We don't know. We're still seeing variants, and I discussed this briefly when I was speaking in the flu. So we don't know that we will ever stop seeing new variants. What we do know is even with this Delta variant that, the vaccine that we have is providing some level of protection. Our infectious disease doctor, he basically told us that the chance of you dying if you're vaccinated, even if you get the Delta variant, is like 0.02% here in Texas. So that's a chance I would rather take, So we have a lot to learn, and, our scientists are working hard, but there are some questions we're still not able to answer.
Yeah, I think you made a really good point though, and that is that the flu still develops new variants every year.
Every year, and every year the shot has to be, done again because they're new variants.
So it's reasonable to expect that the COVID is going to continue to develop new variants as well, but that doesn't mean that we can't fight it with vaccines.
So we have a question on masks, and we all have them. Some are homemade, some are cloth, some are surgical, some are N95. The question is, what's the best for a patient?
So we do recommend not a cloth, not a homemade mask. We recommend a medical grade mask, and most of those are available on websites like Amazon that provides that barrier of protection. N95 we only recommend if you're in a setting like a hospital or a clinic where you're going to be actively testing people or exposed to people who are positive for COVID.
Yeah, so the medical masks actually have a higher grade filter that can block some of the virus coming in, whereas the cloth mask is mostly blocking things from getting out. So if you're trying to protect yourself, you're better off wearing the medical grade mask. And currently, I'm actually in the hospital this week. They're not recommending that we wear N95s anymore unless the patient is actively coughing or we're doing a respiratory procedure with them.
And I will say that any mask is better than no mask at all. We want to protect each other,
Follow up, because again, we all have them. I have 3 in my car, but they're probably a week older or more. How often do you get rid of these things? I mean,
we encourage you to change it daily if you're able to. But I know that I've spent more money on masks than my kids this year. So we understand if you're gonna reuse it, especially if they're medical grade. Honestly, I've washed a couple of them in my scrubs and they come out just like they're brand new. I was like, oh my goodness, these are really.
See, I was wondering about that.
Mm-hmm. I don't intentionally wash them, but I have washed a couple.
Well, let's talk about treatment protocols, because we had a question submitted before the webcast. If either of you have heard about anything anything new that might be used as an effective treatment for COVID, are you hearing anything new?
No, we do have monoclonal antibody available for ages 14 years and above. It's an infusion, so you would go in, get an IV, and it's several hours. For those who are positive, it typically is recommended to be done in immunocompromised patients above the age of 14 in pediatrics. Now in adults, they do it a lot more often in pretty much any adult within the first 10 days. And those who have mild symptoms, now severe symptoms, of course, the treatment would be an ICU setting, possibly a ventilator, and then the subsequent course will depend on the patient's symptoms.
So another question came in, especially as people are going back to classrooms and back to workplaces. We've heard a lot about over the last almost year and a half, going on 2 years now, about social distancing. And those social distances could be as short as 3 feet or as great as 60 feet. Is there any information on or studies out there to evaluate, I guess, what is the best distance to be socially distant?
So the last guidelines I heard, because at one point it was 3 feet, but I think the CDC is still recommending 6 feet of social distancing.
Okay.
And those numbers have to do with things like how long the virus can survive
In the air.
in the air. And so I know there's some people that have raised the question of, well, you've got air conditioning and, and so the air is circulating around the room. And so can't the virus travel further and things like that. But that really does have to do with how long it can survive if you expel it.
So doctors, we have a question. The patient has MELAS and wants to know how the patient would know if they are immunocompromised. How would you know that? What would the best way to find out if you are immunocompromised?
That's a great question. I will say that in general, patients with MELAS are not immunocompromised, but if you are experiencing recurrent infections, odd infections, frequent infections, you should talk with your primary care physician and be evaluated by an immunologist. So generally the only way to know if you are immunocompromised is to have an immunologic evaluation. And typically they do a series of very specific blood work where they investigate for markers of your immune function. So how well does your immune system work?
One final question, then we'll get to the poll results, but this is an important question too. And I'll either one of you can answer. What do you recommend to patient families, what they should do? This would be for adults or children, about caregivers coming into the home. What are the best protocols to follow when you're allowing a caregiver, and I understand this, into your own personal bubble, so to speak?
Yeah.
Mm-hmm. This is the biggest challenge I face because we understand the need for therapy and nursing care and providers in the home. The biggest thing you can do, because you're not, I've had parents who want to ask the providers and people coming in about vaccination status. We're not able to control people's vaccination status, but we can require that they do the basic things. When they're not providing care, they don't need to be, they can maintain social distance in most rooms that people have in their home. Definitely want to make sure they're masked the entire time that they're in the home with you. Definitely want to encourage them not to come in the home if they're having any symptoms of COVID, because you would be surprised how many people say, oh, I just have a little cough. I just have a little. No, if you're ill, please stay at home until you know you're better. And those are going to be the biggest things you can do as a parent, and I know it's a lot, but a lot of my parents are doing virtual therapies and things that we can do to minimize exposure. We definitely want to also do that. So.
Okay, that's all the questions we have for the webcast tonight. And now I want to ask Margaret Moore to come back in and go over the results of the poll that we've had up since the beginning of the webcast about an hour ago. Margaret?
All right, you should be able to see the shared results. I will quick read through just the I guess the top responses that we received. So what best describes you? Most people on this call today were caregivers, but patients were right second at 33%, 42% for caregivers, family members. Have you or someone you love had COVID? 33% said yes, and 67% said no, which is good. And if you or a loved one had COVID, rating the severity, most rated the severity, 50% being very mild. Have you been vaccinated? 79% have been vaccinated. 13% saying they may be in the future, and 8% saying that they would not be vaccinated. Comfortable in getting your child vaccinated? 46% said yes. 42% no, but may as more data becomes available. And 13% said no and don't plan to. Do you and your family wear masks in public areas? 88% said yes, and 13% said sometimes. And what's your comfort level in traveling and being in public places? 17% said you're very comfortable. 21% said you were fairly comfortable. 25% said you were slightly comfortable, and 38%, our winner, said not comfortable at all. So that means most of you are not comfortable in being out and about right now, and that is not a surprising result. I want you to hang tight. I have one more poll question to ask. So give me 1 second and I'll get that ready for you. And this is to help us determine the helpfulness of our Ask the Mito Doc webcast. So I'm going to launch the poll now. It's one question. It should take you a sec. And we thank you for your participation.
Okay, so while you're answering that poll, we will wrap it up. Doctors Koenig and Beaudoin, thank you for your generosity of time tonight, especially given the weather situation where you are and the busyness of your schedules. And thanks to my colleagues, Kara Strittmatter and Margaret Moore, who many of you know are in the background and helping to make sure these webcasts happen for our patient families. Also want to thank families and coming in and being part of the webcast, submitting some fantastic questions. And we really enjoy doing this. So I hope that you will be able to join us October 12th at 6 p.m. as we have a synopsis of scientific information that was presented on mitochondrial medicine 2021 this past summer. So it's going to be very interesting. It will be done for a patient family perspective. So we hope you'll be able to join us. And until then, stay healthy and be safe.